Hi, we are discussing acute stress disorder neighbor, which is post-traumatic stress disorder. And most of the people who go through traumatic events may have temporary difficulty adjusting and coping, but with time and good self-care, they usually get better. If not, it go to post-traumatic stress disorder or initially to acute stress disorder. These symptoms can cause significant problem in social uh, and or work situations and in relationships. They can also interfere with your ability to go about your normal daily activities or daily tasks. And by official definition, post-traumatic stress disorder is a mental health condition that's triggered by a terrifying event, either experiencing it or witnessing it. Symptoms may include flashbacks, nightmares, and severe anxiety, as post-traumatic stress disorder is also from family of anxiety disorders, as well as uncontrollable thoughts about the event, and symptoms may start within 1 month or after 1 month of a traumatic event, but sometimes symptoms may not appear until 1 year. So it can appear after 1 year of the traumatic event. Risk factors. People of all ages can have post-traumatic stress disorder, and however, some factors may make feel patient more likely to develop post-traumatic stress disorder after a traumatic event, such as experiencing intense or long-lasting trauma, having experienced other trauma early in the life, such as childhood abuse, having a job that increasing your risk or being exposed to traumatic event, having other mental health problems, substance misuse or excess drinking like alcohol abuse, lacking a good support system from family or from your friends or relatives, and having a good relatives with blood relatives with mental health problems. Of course, parents are most predisposing to the disorder. If you have parents with such disorder, you can develop as well. Okay, symptoms. Post-traumatic stress disorder can disrupt your normal daily activities and your ability to function. Only a single word, sound, or situation that remind you of trauma can trigger symptoms. In addition, people with post-traumatic stress disorder may experience depression and panic attack with symptoms like agitation, especially for panic attack, excitability, racing heart, and headache. The most important symptoms are intrusion, avoidance, arousal, and reactivity, cognition, and mood. Intrusion mean flashbacks where you feel like you relive the event over and over, vivid and pleasant memories, of course. Avoidance, as the name implies, means avoiding people, place, name, situation, or everything that is related to the trauma event. Arousal and reactivity, trouble to concentrate, startling easily, and having an exaggerated response. And cognition and mood, negative thoughts about yourself, distorted feeling of guilt, worry, or blame. Trouble with remembering important parts of the event, and reduced interest in activities you once loved previously. Diagnosis. So all of the following symptoms for 1 month or longer. More than 1 month. At least one re-experienced symptom. At least one avoidance symptom. At least two arousal and reactivity symptoms. Arousal and reactivity. Two symptoms. And at least two cognition and mood symptoms for establishing diagnosis. treatment of cognitive behavioral therapy or talk therapy encourages to process a traumatic event and change the negative thinking pattern linking uh, to the process. So, in exposure therapy, patient re-experience elements of to the trauma in a safe environment. The same feelings, only a safe environment. This can help desensitize patient to the event and reduce symptoms. Antidepressants, anti-anxiety drugs, and sleep aids also helps. Only two drugs, SSRIs, are approved by FDA and are working well with disease: sertraline and paroxetine. Does have some complications. Post-traumatic stress disorder, of course, having and may also increase risk of other mental health problems such depression and anxiety, issue with drug or alcohol use, abuse mostly, eating disorders, and suicidal thoughts and actions. Of course, it is disorders that can disrupt your whole life, your job, your relationship, your health, and your enjoyment of everyday activity. For preventing this, you need also encouragement and support from your family and your close relatives, which is much important. Have a good time and hope this video is useful for you.